All right, it is just after 1 o'clock, so I'm going to go ahead and get us started off here. Welcome everyone, and thank you so much for joining us for the 24th Annual Virtual Elder Abuse Conference, Evolving Interventions and Resources. This conference is presented by Caring Transitions of Syracuse, and my name is Lauren Ulrich, and I'm the Abuse in Later Life Prevention and Outreach Coordinator at Vera House. All webinars offered during this conference are free thanks to the generous support of our sponsors. In addition to our presenting sponsor, this year we're fortunate to have 3 platinum sponsors: Loretto, Onondaga County Department of Adult and Long-Term Care Services, Syracuse Jewish Family Service, and I'd also like to acknowledge our gold sponsor, Weichmann's, and our silver sponsors, At Home Independent Living, Bousquet Holstein PLLC, Christopher Community Incorporated, Community Bank, Countryside Federal Credit Union, Fulton Savings Bank, Geddes Federal Savings and Loan Association, the Marone Law Firm, and Touching Hearts at Home. And just as a reminder, more information about all of our sponsors can be found on the Vera House website at the virtual resource table link on the conference registration page. The support of these sponsors not only funds this webinar series, but also extends beyond our conference to continue elder abuse education, outreach, and prevention work after this event. Just a final announcement before we begin today's session. Zoom offers both a chat and a Q&A feature that you'll find at the bottom of your screen. And at various points in today's session, our presenter, who I'll be introducing in just a moment, is going to be asking you to participate in some discussions, and you're welcome to do so through the chat function here. And I would just invite you, when you open the chat and are about to send a message, ensure that you're sending the message to all panelists and attendees. So you'll have to check that drop down to make sure it's going to us as well as all the attendees so we can all see each other's conversation. And you're also welcome to submit questions via the Q&A feature, and hopefully we'll have some time at the end to address any questions that come up. So without further ado, we can get started on today's session. Substance abuse among older adults is rising. It's now my pleasure to introduce you to today's speaker, Meg Raymond. Meg is a certified alcohol and substance abuse counselor at Kraus Health Addiction Treatment Services. And with that, Meg, I'll turn it over to you to introduce yourself and start our session.
Okay, hello everybody, and good afternoon. As Lauren mentioned, I am a certified alcohol and substance abuse counselor and have been credentialed in this field for over 25 years. I am certified as a CASAC and have worked in numerous different populations, including the criminal justice system, pregnant and parenting women, adolescent girls, and helped to implement and facilitate a family program that was offered on the weekends. I'm currently in the admissions department, and so my primary responsibilities are screening, completing evaluations, making treatment recommendations and referrals, and connecting individuals with services and resources within their own community. 2 years ago, I returned to school part-time for my master's in social work in hopes to work more with the older adult population. And I recently had the opportunity to do a field placement with Vera House in their elder abuse program. And that's how I ended up here. So thank you all for taking the hour this afternoon to spend with me to discuss this very important topic. So let me share my screen here. Okay. So why is this important to talk about? Well, for many reasons. More and more older adults are misusing alcohol and other substances, while their aging bodies and brains are becoming more vulnerable to the harmful effects of these substances. These physiological and mental changes increase vulnerability and can lead to adverse drug reactions. And because one of the biggest health risks is the mixing of alcohol and medications. As we age, our metabolism slows, we have an increase in fat, decrease in water, decrease in kidney and liver functioning, which leads to an increase in toxic levels for longer periods of time. Our bodies can't rid itself of medications or alcohol as quickly, leading to a buildup. This increases vulnerability and makes identifying substance misuse in the older adult population even more critical. And because of these changes that occur, older adults become more susceptible to confusion, medication errors, falls, fractures, car accidents, and worsening of existing health conditions, such as diabetes, heart disease, high blood pressure. Mixing alcohol and medications is dangerous and potentially deadly. And lastly, because this population is under-recognized, underdiagnosed, and undertreated, our aging parents, our grandparents, our friends are vulnerable and irreplaceable, and we can't ignore or passively sit by and allow addiction to take them from us. This presentation will focus mainly on alcohol and prescribed medications like benzodiazepines and opiates, because these are the primary substances that are most often misused by this population. It should be noted that older adults do misuse illicit drugs, such as cocaine, heroin, methamphetamine, but time doesn't allow me to go into these in more detail. However, the number of older adults misusing those substances is also increasing. So why are we seeing an increase in the number of older adults experiencing substance use disorders? Well, for one reason, baby boomers are aging, and they grew up during a time when substance use was more culturally acceptable, making them more open to substance use than prior generations. This exposure to drugs and alcohol at a younger age has led to higher rates of past or current substance use disorders compared to previous generations. Another reason is the opioid crisis and the abrupt discontinuation of medications, leading those who innocently became dependent to turn to other things. And COVID, which contributed to forced isolation, loneliness, economic and health stressors that have led to an increase in substance misuse. We know that since March of 2020, alcohol sales have risen 54% because people are turning to alcohol and other substances to deal with the stressors and emotions associated with the pandemic. A study that was done by the National Emergency Medical Services Information System, which is a large registry of more than 10,000 EMS agencies across 47 states, showed an increase in overdose deaths during this time. The highest rates being in May of 2020, and that happened to be when the stay-at-home orders were put in place. So far, the 2020 values had increased by 50%. So how do we define a substance use disorder? SAMHSA, which is the Substance Abuse and Mental Health Services Administration, is a branch of the US Department of Health and Human Services, and they define it as the recurrent use of alcohol or drugs, which causes clinically significant impairment, including health problems, disability, and failure to meet major responsibilities at home, work, or school. Substance use disorders are diagnosed using the DSM-5, which is the Diagnostic and Statistical Manual of Mental Disorders. Substance use disorders are sometimes referred to as having an addiction or being chemically dependent. Whatever term is used, it is a disease. It is a disease that people often have a difficult time understanding, and many believe it results from a lack of willpower. Substance use disorders cannot be cured, but they can be treated just like diabetes or high blood pressure. This disease, left untreated, is chronic, progressive, and fatal. So the 2019 National Survey on Drug Use and Health is an annual nationwide survey conducted by SAMHSA. They found that 10.7% of individuals aged 65 and over engage in binge drinking in the past month, and an estimated 2.8% engaged in heavy alcohol use. And I'm sure you're wondering what the difference is. So as we age, dietary guidelines change. As defined by SAMHSA, moderate drinking is consuming up to 1 drink a day for women and 2 for men. Exceeding these numbers can lead to what is considered high-risk drinking. Heavy drinking is 2 drinks a day for women and 3 for men, or 7 in 1 week. And binge drinking is 3 or more drinks in 1 sitting. So older adults who drink at all while taking certain medications, such as opiates or sedatives, or who drink despite having a medical condition that drinking can exacerbate, like diabetes or heart disease, or who drink while planning to drive or engage in activities that require alertness, are engaging in high-risk drinking. So what is a drink? This slide just shows the measurements of how a drink is defined based on the type of alcohol being consumed. So most people do not measure their alcohol intake, so it's important to determine more accurately how much one is consuming. When someone tells you 1 beer, it's important to clarify, is it a 12 ounce, 16, 24, or 40? There's a big difference between 1 12-ounce beer and 1 40-ounce beer. Alcohol damages every body or every organ in the body. The heart, as we age, our cardiovascular system undergoes many changes, predisposing us to heart conditions such as heart failure and coronary artery disease. Alcohol increases the amount of cholesterol and fatty acids in the body, increasing the workload of the heart, which can cause high blood pressure, irregular heartbeat, and inflammation of the heart muscle, which weakens the heart, leading to heart failure and death. So this is a picture of an enlarged heart, and you can see the hand next to it. So your heart is about the size of your fist, is what they say. So, I mean, imagine that if you opened up your hand to see the heart is bigger than this individual's hand. So it's quite large. If alcohol affects the brain, so alcohol is a sedative and it acts on the central nervous system, which consists of the brain and spinal cord, decreasing our ability to function, impacting our behaviors, our cognition. It impairs judgment, our reasoning, our ability to learn, coordination, memory, and speech, which can also lead to severe brain damage, known as Korsakoff syndrome, also termed wet brain. It impacts parts of the brain that affect learning, language, and memory, and leads to an inability to remember recent events and experience long-term memory gaps. The pancreas. So the pancreas has 2 primary functions: digestion and blood sugar regulation. Alcohol can cause pancreatitis, where digestive juices build up and it begins to eat away at itself. Pancreatitis is extremely painful and can result in death. Alcohol can also be a source of secondary diabetes by interfering with the production of insulin. Alcohol impacts our bones and blood. So alcohol can contribute to osteoporosis, which is what you see on your screen. That's a picture of osteoporosis is on the left. It can lower your ability to fight disease, causes anemia, and can increase bruising. It reduces the production of red blood cells, which carries oxygen from your lungs to your body tissue, and white blood cells, which help fight infection and inflammation. Alcohol also impacts the digestive tract. It affects the health of the esophagus, the stomach, and intestines. It can cause gastritis, bleeding ulcers, perforations in the wall of your stomach, swelling, and causes obstruction of passageways, and can cause colitis. Alcohol also reduces absorption of vitamins such as vitamin B, zinc, calcium, and magnesium, which can lead to memory loss, depression, disorientation, instability, headaches, visual disturbance, and an inability to heal. That's a picture of a bleeding ulcer, in case you were wondering. Kidneys. When alcohol is present, the kidneys can't filter the toxins from the blood as they're supposed to. Alcohol inflames the lining, leading to fluid retention and swelling of the tissue, which can lead to permanent kidney damage. For some, placing them on dialysis for the rest of their lives. There is no cure for kidney failure. Treatment is dialysis or a kidney transplant. However, if you're misusing alcohol, it can be a long process to prove abstinence in order to be eligible to be put on a list to receive a kidney. It also impacts the bladder, which I did not include a slide on, by irritating the lining and leading to incontinence, and then the liver. So alcohol leads to jaundice, alcoholic hepatitis, cirrhosis, lower high blood sugar levels, varicose veins, increases cholesterol, and can lead to fatty liver and gout. So alcoholism causes 75% of esophageal cancer, 50% of larynx cancer, and increases the risk of contracting lung, liver, gastric, colorectal, pancreatic, breast, and brain cancer. So why do I tell you all of this? Well, a study conducted at University of Maryland found that 10% of patients, 60% or 60 years old and older, who were diagnosed with Alzheimer's were actually suffering from brain damage or toxicity caused by their drinking. It is often the symptoms that grab our attention and get treated, while the underlying cause goes ignored, undiagnosed, and untreated. Some statistics. So these are just a few statistics pointing out the severity of alcohol and substance use among older adults. I'm just going to point out a few. We know roughly 1 in 5 older adults suffers from substance use disorders. Use of illicit drugs rose from 2.7% to 10.4% in older adults between 2002 and 2019. That's almost quadrupled. Most recently, I received a report from the state of Florida Medical Examiners Commission reporting alcohol-related deaths among older adults increased across the state from 2012 to 2019. The number of decedents in which alcohol played a causal role in their death has increased by 72%. 72%. So I wonder what the year of 2020 would look like, the year of COVID. One of our main concerns are the combination of alcohol with central nervous system depressants, like anti-anxiety medications, such as benzodiazepines like Klonopin or Xanax, and sedatives like opiates, Ambien, Lunesta. These medications affect brain function and can result in changes in consciousness, behavior, mood, perception, and thinking. This is a rhetorical question. So why do you think substance use among older adults goes unnoticed? Addiction doesn't discriminate by age. People don't become immune to it just because they are getting older. So why does substance misuse go unrecognized in our older adult population? Well, societal norms, values, and biases play a huge role. Ageist false beliefs that older adults don't misuse alcohol or other drugs, especially illicit ones. Caregivers or healthcare providers mistake symptoms of substance use disorders for normal age-related changes. Healthcare providers are focused on physical or medical complaints or may lack the time or screening tools. Signs and symptoms of substance use disorders often resemble those of other health issues, making them more difficult to detect. And older adults hide their substance-related issues from caregivers and providers due to stigma, shame, or maybe they don't see their use as a problem. Another rhetorical question. So when you picture someone with a substance use disorder, what image comes to mind? Most likely not one of an older adult. So if we know this is an issue facing our older adult population, why aren't we seeing them accessing treatment? Well, family or caregivers may be uncomfortable talking about substance misuse and might be afraid to make waves or intrude in their lives. After all, they're grown adults and can make their own decisions. Family or caregivers may deny there's a problem, especially if it's been long-standing. Maybe they lack the knowledge surrounding loved ones' increased vulnerability due to body and brain changes. And there's misinformation about treatment that older adults can't be treated because they're set in their ways. Or maybe they don't know how to access treatment. Also, shame, guilt, stigma, embarrassment. Older adults born before World War II may have moralistic attitudes about drinking and drugs. Some were shaped by prohibition and the temperance movement and feel deep shame about their substance use. Inaccessibility, feeling shut out due to the need for accommodations. Maybe they need an interpreter, or they're hearing impaired, or have mobility issues. And gender and sexuality. Older adults' gender and sexual identity can affect whether they seek and receive help. Maybe they fear discrimination, that the provider will refuse to care for them. Understanding these barriers is a key step in reducing substance misuse in older adults. Such misuse limits their ability to function and to achieve the best quality of life, regardless of age. So risk factors, there's a lot of them. I already mentioned some of these. So growing up during a time when alcohol use was more acceptable. We also know that addiction tends to run in families. However, not all family members are necessarily prone to addiction. Same with heart disease or diabetes. There's no one gene that makes you vulnerable. We know the younger one is exposed or experiments with alcohol or substances, the increased risk they have of developing substance use disorders. And chronic pain, sleep, and mobility issues equal an increase in prescribed medications which are often opiates or sedatives. Realities of aging, loneliness, maybe losing a spouse, feeling the lack of purpose, maybe being forced into retirement. Maybe they can't remember if they took their medications, so you take more or you don't take them at all. Trauma, we know those who experience adverse childhood experiences such as abuse, neglect, parental mental health or substance abuse, those who witnessed interpersonal violence or experienced economic hardship are 4 to 12 times more at risk for increased health risks, alcoholism, drug abuse, depression, and suicide. The environment. So leaving their home and relocating to an assisted living or a nursing home, it's another loss. Losing independence or feeling like a burden. Mental health. So as we age, we're at greater risk of developing depression and anxiety. Social changes. Maybe we become less active or socially disconnected from family and friends. And economic stressors, rising medication and healthcare costs, living on a fixed income. And then COVID-19 again has impacted all of those things that I just mentioned. Protective factors. So we know that protective factors can reduce the risk of substance misuse or make it less likely to occur. Protective factors include a person's strengths, skills, and abilities, as well as environmental factors. Many of these focus on relationships, feeling connected, belonging, having a sense of purpose, self-determination, independence, and access to needs such as safe housing, food, medication, and healthcare. Many of these protective factors were also impacted by COVID-19. It led to a lack of connectedness due to social distancing and forced isolation. Support networks such as places of worship, senior programs closed down. Medical care went from in-person to telehealth. Access to needs such as groceries, cleaning supplies, medications, placed older adults at increased risk of contracting COVID, which for them meant an increased risk of death. So I want to show you a brief video clip that demonstrates some of the challenges in recognizing substance misuse in older adults and why it can often go unrecognized. So bear with me here while I bring this up.
Oh, hello, Dr. Crane.
Hi. So, what brings you in today, Mrs. Alton? It's too early for your follow-up appointment.
Well, I think I have problems with my blood pressure medication. And my son thinks that I should go into a home because he thinks I'm alone too much, and that is just crazy.
Does he have a reason to think that you can't manage on your own?
No, but I think maybe he's feeling a little guilty because I do all the gardening and the work around the house, and he doesn't have a chance to give me a hand. And actually, I can do more than he can, really, because I've got all day to do it, and he can only drop by a couple of times a week.
Well, he must have a reason to think that you can't manage on your own. Have you been forgetting things?
No, I haven't. But I have been losing my balance and sometimes falling. I've told my son that I'm sure it's my blood pressure, but he just doesn't listen.
Mrs. Alton, the nurse checked your blood pressure when you came in today, and it's under control. But you say you've been falling.
Yeah, well, look, I'm covered in bruises.
Oh.
Mm-hmm. And sometimes I feel woozy.
What do you mean, woozy?
Well, I have trouble keeping my balance, and I've been falling down.
Are you feeling that way right now?
Oh, heavens no, I wouldn't leave the house if I were feeling like that. You know, this just seems to happen at night.
At night? Mrs. Alton, have you been drinking again?
No, I've just been having my sherry.
Mrs. Alton, we've had that conversation before, and you agreed that you would give up alcohol so I could put you on this new medication.
Well, I did. I'm just having sips of sherry, you know.
Listen, sipping sherry is still drinking. Alcohol is alcohol. Now, how many glasses do you have in an evening?
Oh, not a lot. I just sip while I'm watching TV because, it's so boring. And being alone, because my husband's gone now, there's just never anything interesting to watch on TV these nights.
You know, Mrs. Alton, at your age and having high blood pressure and living alone, I really don't think you should be drinking. And maybe that's what your son's worried about. Mm-hmm.
Okay. So a couple of questions that you can put your responses in the chat box, and then Lauren's gonna let me know what's in there because I can't see it. So how did Mrs. Olton present to the doctor?
Just a reminder to everybody, you can go ahead and submit your responses in the chat feature. If you go down to the bottom of your screen, where you can mute yourself, you can also see the chat. And if anybody's struggling with the chat, you can also feel free to use the Q&A. We haven't gotten anything in the chat yet.
Okay,
But
well, I
people
can
can
go
use the
ahead and
Q&A
answer
as
my own
well.
question.
I'll let you know if we get anything.
Okay. So she presented well-groomed, her hair was done, nicely dressed, put together, friendly, personable. She was sweet and soft-spoken and concerned about her blood pressure. But would you suspect she may have an alcohol use disorder? And why or why not? If you want to try to respond in the chat with that as well, I'll give people a minute. So would you suspect she may have an alcohol use disorder? Why or why not?
So somebody said is that, I think maybe this is related to our first question, that maybe the patient was downplaying her use at first.
Mm-hmm.
Or that could be answering that second question as well, in terms of the initial suspicion that might affect how you perceive her, how she was kind of initially downplaying the use of alcohol there.
Right. Yeah. Good point. Good observation. So, and if her doctor didn't know her history, it may not have been discovered. You know, may not have been, she might not have been screened and might not have disclosed it. Because the doctor kind of asked her, you know, are you drinking again? And she doesn't see her sherry as alcohol. She doesn't consider that a problem. So that, you know, it just points out the importance of establishing a primary care physician who knows their patients, who might be able to identify some of these signs and symptoms of substance use disorders, because most people aren't very forthcoming with that information. So third question, what were some of the indicators mentioned that might lead one to suspect possible substance misuse? Okay.
Sorry, Meg, I'm not sure
That's
if
okay.
maybe people are struggling with the chat. On my end, I can see that the chat is set to be enabled so that people should be able to use it. But we know
Okay.
technology isn't always perfect, so there,
That's
even though it
right.
looks right on my end, it may be causing some issues for people. Again, if that is the case, if the chat isn't working properly, I would definitely encourage people to try the Q&A.
Okay.
Oh, we did get one response in the chat. That the report of her falling, this person said falling at night, that was a potential indicator.
Yes, good. Okay. So yeah, that was a big one. Her losing her balance, her feeling woozy. And again, like that person mentioned, that it happens at night. You know, a lot of people may just kind of chalk it up to her being tired or not eating well, being dehydrated, maybe her medications are off, but these are not normal signs of aging. They're not. I know a lot of people want to think they are, but they're not for a lot of people. So we'll move on in the sake of time. We're going to skip this. So I'm going to ask you to take a minute and look at this slide and think about which of these symptoms might mimic normal signs of aging. I'll just give you a minute to look at all those. So one or more of these signs can be a warning sign of substance misuse. However, they can also be indicators of so many other things. So this is why adequate screening and evaluation are so important. In addition to a substance use evaluation, the National Institute of Health also recommends that older adults complete a cognitive impairment evaluation, have medications reviewed, and complete a urinalysis as part of their assessment process. So universal screening. The unique physical, emotional, and cognitive challenges older adults face tend to mask substance use disorder symptoms, making it more difficult for providers to identify and address. We need to have universal screening, which is a brief assessment strategy that looks for unrecognized conditions or risk markers that can help determine who may need further assessment. Healthcare and social service providers are in the perfect position to screen older adults who are accessing their services. We can all be aware of the signs of substance misuse among this population. Within our own scope of practice, we can engage in routine screening for substance misuse. Most will screen negative, but pre-screening helps identify substance misuse that may otherwise be overlooked. Across settings, early identification, universal screening, and education for substance misuse can facilitate brief interventions that can be delivered in a variety of healthcare and social service settings, and can effectively reduce alcohol consumption and substance misuse and help lower related health risks among older adults. Brief interventions can be used to facilitate a referral for further evaluation. Risk reduction practices can lessen the impact of substance misuse on the physical and mental health of older adults. So settings where screenings can take place, I'm sure there's more than what's listed here, but healthcare clinics, hospitals, particularly emergency rooms, substance use disorder treatment agencies and mental health programs, home health care providers, nursing homes, social service agencies, senior centers, assisted living facilities, faith-based organizations, and anybody else who wants to do the screening. But collaboration among service providers across settings is essential when working with older adults who misuse substances, particularly for those with co-occurring medical conditions and mental health disorders. So a short screening tool, which you can use and is also effective in detecting alcohol and drug misuse in older adults, is called the CAGE questionnaire. It consists of only 4 questions and can be altered to screen for mood-altering prescribed drugs also by replacing alcohol with the name of the drug. So the acronym CAGE stands for cut down, annoyed, guilty, and eye opener. So you ask them if they've noticed any of these concerns and inquire about what stressors are going on in their lives that may be triggering their use. So language, when talking to somebody who you think might have an issue with substance use, language is really important. You don't want to talk down to them. You want to listen and learn. Use terms like harmful use or unhealthy use. Do not use addict, abuser, or alcoholic. Empathize with what they're going through and normalize it. You can say something like, it's normal to seek an outlet for coping with feelings of grief or loss. And then ask how you can best support them in getting the help that they need. These are just some additional screening tools that you can look at, and they're included at the end. There's a reference list and a resource list too. But you want to talk with your loved one, share your love and concern, point out what you admire about them and their values, their attributes, things that might motivate them to get help, like staying in their home or having quality time with their grandchildren, whatever it may be. So these screening tools are really just for your own reference. After screening a patient, the results should be reviewed with them to help them understand their risk level of the consequences of their continued misuse. And you can gauge their motivation and readiness for change. It should be noted that some of these tools require formal training. So again, as I mentioned before, within your own scope of practice, determine what's appropriate to use for a screening tool and what isn't for your particular profession. So what to expect if someone is referred for a full assessment. So if someone you care about needs a evaluation or an assessment, this is what's going to likely happen. So there's several parts to it. First, a complete biopsychosocial is completed. So that's obtaining a full history in relation to mental health, physical health, family, employment history, schooling history, social, sexual, financial, legal, substance use, of course, and substance use treatment history is obtained. A health history and physical exam is completed, where we have a full listing of prescribed medications and over-the-counter medications will be reviewed with a nurse. And a urinalysis and a breath test are completed. Sometimes a referral to our psychiatrist or psychologist to further assess for co-occurring disorders is a part of that assessment process also. So I wanted to highlight, this is kind of off the chart a little bit, but I wanted to highlight the importance of also paying attention to those who care for our loved ones. We know that caregiving can present many challenges and can often lead to stress, frustration, fatigue, depression, feelings of hopelessness. It's not uncommon for caregivers to let their own physical and mental health suffer. Sometimes they too can turn to alcohol or substance use to manage their feelings. However, this can come at a great cost and can severely impact those they are caring for. Can lead to medication diversion, forgetting to make a meal, bathe, or change their patient. Perhaps they over-medicate their patient to make it easier for them to take care of them. It can lead to abuse, neglect, and financial exploitation. So if you have a caregiver, check in on them and see how they're doing. If you suspect possible substance misuse, talk with them. See how you can support them in getting the help that they need. The goals in having these important conversations with your loved ones or patients is to improve their health, maintain their functioning and independence, and improve their quality of life. People who misuse substances often don't see their use as a problem. Older adults may feel alone in their situation and not reach out for help. There is hope and help for this vulnerable population. The first step is to identify the problem and begin the process of helping your loved one reach out for support. An older adult left to find help on their own is at high risk of dying first. And some treatment options. So as mentioned in my introduction, I do work for Kraus Health Addiction Treatment Services. We do offer a specialized program for adults 50 and over, and we're the only agency in the area that does. But on here, you'll also see, I've listed other agencies in the area that also treat substance use disorders. But older adults have unique needs. They're in a different stage of life and grew up in a time where having an addiction or mental health issue carried a great deal of stigma. We still have a lot of stigma today surrounding substance use and mental health. But for older adults, sometimes attending mixed groups with younger people can lead to them feeling like they become mom or dad, and they start to tend to the other patient's needs. They often don't like the language or the profanity that's used. So it's important to provide a space that feels safe and comfortable, where they can feel free to discuss any age-related or generational issues with their peers. And group sessions should be designed to meet older adults' needs. So this slide just shows you what Crouse also offers in terms of different forms of treatment. And it's not only for older adults, but for anybody who's suffering from a substance use disorder. My contact information is provided, so please reach out if you or a loved one or someone you know may need help. You can call anonymously for information. You don't have to come to Crouse for services. We will provide all resources to you, or so you or they can decide on what you want to do and how you want to proceed. The most important thing is that people get the help they need before it's too late. So I want to thank you all for listening and for spending this time with me. And I will have it opened up for questions. You can put them in the Q&A, and if you'd like, and I'll answer as many as I can. If I don't get to your question, please, again, feel free to email me or call me anytime as well. I do want to mention, sorry, Lauren, that we are moving. I don't know if I had that on the previous slide. So as of tomorrow, it is our last day here at 410 South Crouse Ave, and our location for outpatient services will be moving to 2775 Erie Boulevard East. Okay, thank you.
Thanks, Meg. We do have a couple of questions in our Q&A. I just wanted to take a brief moment to recognize after we tried to do a discussion through the chat, I did get a lot of feedback in the Q&A that people were trying to send messages in the chat. Most of them were not showing up on my end and we don't know why. So I just want to
Okay.
acknowledge people were trying to participate with you, and sometimes
thank you,
technology
everybody.
doesn't want to facilitate that, but we do
Yeah.
have quite a few questions here.
Okay.
Our first question is, are you familiar with organizations who offer similar help and services in the counties surrounding Onondaga County?
Some, yeah, it depends on the county. So Oswego County, there's Farnham, Harbor Lights, there's different agencies. Yes, we can help you. If I knew exactly what county you were referring to, then we could certainly refer you to places within your own community to get help. So I would encourage you to call. You can call me. My phone number is on the screen. I'd be happy to help direct you someplace.
Wonderful, thanks. We have a couple of questions asking if the PowerPoint and resources will be made available. If it's okay with you, Meg, I can go ahead and share it with everyone who attended today via
Sure.
our Zoom registrations. I'd be happy to do that.
Yes, definitely.
Oh, and we just have a quick question that if you were unable to attend yesterday's session, will there be a recording? So yes, actually for all of our conference sessions, we are recording all of them. When the conference is over, they'll be posted on the Vera House website. So yesterday's session and all of the others will be made available probably beginning of July.
Should I stop my share?
Sure.
Okay.
Just give it a couple more seconds just to see if we get any other questions. I definitely don't want to not give anyone the chance to participate, especially with that little glitch that we had earlier. So leave the Q&A open for a few more seconds here. And while we do that, Meg, just want to thank you again for your time today, for sharing your expertise and your knowledge, and for being willing to continue to be a resource for everyone who attended today to reach out to you with questions. So thank you so much for that.
For letting me be a part of this.
Absolutely. Doesn't look like we're getting any more questions, so I think we can probably wrap up for today. Thank you everyone for being here, and thank you to our interpreters as well. Any questions, feel free to contact me or to contact Meg, and I will be sure to get that PowerPoint out to everyone later this afternoon. And we are getting a thank you in the chat, so now I can see a thank you. All right, thank you so much, everyone. Take care and have a wonderful rest of the day.
Thank you, everybody. Thank you, Lauren. Bye-bye.